Hey guys, welcome back. Today I'm going to talk about the NREMT psychomotor exam. Last video I put up was about the cognitive exam. If you guys haven't watched that yet and are wondering about some tips for handling that exam, you can check out that video. But for this video, we're going to focus on the psychomotor exam. I took the psychomotor exam probably a month or so before I took the cognitive, and it was mentally taxing, definitely. Very stressful, and I actually think that the psychomotor is harder than the cognitive, in my opinion. But if you prepare properly for the psychomotor, it makes cognitive that much easier. Bottom line, you really just have to know your information. You have to study. You have to know your treatments, your medications, have a thorough assessment memorized or constructed so you can go in confidently and handle it well. Having that said, let's get into it. What is the psychomotor exam? So that's basically like the hands-on portion for National Registry. You have cognitive, which is the written exam, and then psychomotor is where you actually act out the skills, go through patient assessments, like a trauma assessment, etc. There are 6 categories or testing stations. You have the trauma assessment, you have dynamic cardiology, you have static cardiology, oral station A, oral station B, and then the rather new integrated out-of-hospital scenario. I'm going to break all these down. I'm not going to go too in-depth in all of them, but I will give some tips and some tricks on, maneuvering these and what I found to really make the process a lot less stressful and easier, which ultimately set me up to pass all of them. I didn't have to repeat any of them, so I'll do what I can to break it down, and hopefully you find some of this information useful. I'm just going to state now that any of the tips I give you or examples, etc., are not from my psychomotor exam or anyone else's. I just came up with them to give you an idea of what to expect. We'll start with the trauma assessment. The biggest tip I can give you for the trauma assessment is honestly just make sure you're hitting down on all of your points on your head to toe exam. If you head over to the NREMT website, I'll actually throw it up on the screen. You can get a grading rubric, the one they actually use. You can look at it, memorize it, do whatever you want with it. You have all that information before you even go to test. So I would definitely utilize the opportunity to look over that sheet. What I did was I actually went on Google, printed out like a blank anatomical figure front and back, and then I put on each little section of the body, and I can show that as well, different assessment points you want to hit. So, are you checking pulse, motor, sensory, and all the extremities? So what I did was I marked that on each of the extremities. Are you checking for JVD, tracheal deviation, any sort of abnormality in the chest? So for that, it really just helped me visualize, okay, what am I going to do when I get in there and I see the patient? Other than that, other than making sure you have a thorough assessment done, things like controlling a major bleed before anything else. When you ask for the general impression, or they give you the general impression, if you see that they have spurting blood, obviously you want to apply pressure, tourniquet, etc. before you do anything else. Okay, with a trauma patient, you want to control that bleeding, and then you go straight to your ABCs. Having that said, another thing is little things like lung sounds. You don't want to miss a pneumo or something like that, so make sure you're listening to lung sounds. Like I said before, you don't want to forget things like JVD, tracheal deviation. Make sure you're doing a thorough assessment of the full head, checking for skull fractures. If something is as simple as the patient's vomiting or something like that, make sure you're suctioning. Just these little things that are ultimately going to, could potentially be the difference on whether you pass or fail. Other than that, make sure you are treating for shock always. This is pretty standard. Keep your patient warm, fluids, supine, just the drill if you've made it this far. Having that said, do make sure you know your fluid rates and you're checking lung sounds between increments, stuff like that. It's those little things, like I said, that are going to make the difference. And next, we'll move on to dynamic cardiology. And before I get into that, I do want to give a very important tip. This is one of the best things you can do for yourself throughout the whole day, since it's going to be an all-day event sort of thing. When you leave a station, walk out of the station and completely wipe everything clean slate. Don't think about the station that you just did, because if you start thinking that you did poorly on the previous station, all of the subsequent stations to follow are going to be that much harder. You need to be focused 100% on whatever station you're in. And if you're busy thinking about the previous station, that is only going to distract you. So anyways, I just wanted to say that. But we will move on to dynamic cardiology. I'm not going to put a monitor up on the screen in the video or anything. There's other great YouTube videos for that, or if you want to go back to your class or whatever, I'm sure they have a practice monitor that I would definitely utilize. Other than that, I know there are also websites where you can practice rhythm recognition and whatnot. But for dynamic cardiology, my best tip is that you stay relaxed and take your time. It's gonna go by quick, but you can't just lose yourself in the spur of the moment because you have a code going on or whatever the condition is of the patient. Other than that, check pulses. You do not want to shock something or administer an improper medication or treatment that does not warrant it. So just simple things like checking a pulse and even breathing, just checking your patient condition before you continue going down the different rhythms and treatments. Other than that, know your ACLS algorithm. You have to know that. That is going to be your biggest thing. Know your joules. So for that, know what type of defibrillator you have. Is it biphasic or monophasic? Little things like that, while they seem subtle, it's very important because these are little things that you could start panicking about in the heat of the moment. So that's dynamic cardiology, and like I said, I don't have much to say about it because I can't give you that great of an example without pulling up a rhythm or a monitor. But like I said, the important thing is that you just stay calm, check your pulses, and just know your algorithms, know your drugs. Moving on, static cardiology. It's a little different. It's a little slower paced, I would say. But again, you have to take your time. If you don't know whatever is in front of you, you can skip it and you can come back to it. Second, when you read your rhythm or strip or whatever it is, say your full treatment. Don't say one thing and then expect the person who's not the preceptor but the test attendant or whatever you want to call it They're not going to say, okay, now your patient is this. No. You're going to get a strip, say your whole treatment, and then move on. I will give an example. Let's say we have the strip on the screen. Okay, so you're gonna get a scenario with it it's gonna say on there, 60-year-old patient complaining of fatigue. Okay, this is sinus bradycardia. I'm going to monitor the patient, give O2 as needed, cardiac monitoring, that is, initiate transport. In the event that my patient becomes unstable, I'm going to administer 1 milligram of atropine IV push up to 3 milligrams. I will also consider transcutaneous pacing if the patient does not improve. Something like that. Say everything and then move on. Next is oral stations. You're going to have two of them, oral station A and oral station B. These, in my opinion, were the easier ones as long as you do a thorough assessment. They should give you a piece of paper that I would definitely utilize, and I will again put up on the screen what I kind of did, where you want to hit this is where you're going to, what I would do is write down your OPQRST, sample, even put vitals if you need to at the top. Remind yourself of BSI scene safety. A little side note, make sure you're saying BSI scene safety for all of the stations. You do not want to fail on something simple like that. I know this is kind of a given, but again, when the nerves are running, little things like that you can forget. But as far as the oral stations go, the best thing I can recommend is, one, know your medical emergencies. This is very important, whether it be a diabetic emergency, a psychiatric emergency, whether it be, anything neurological. Do we have a stroke, head bleed, etc. You want to be able to spot that out. Second, the medications. Make sure you know your medications. Make sure you know the proper dosing. Like I said, I did not think the oral stations were that hard in general, but it can be the little things, and that's why I said write down your list of vital signs, so when you ask for it, you can jot it down. You do not want to forget something as simple as a glucose or a temperature. Is your patient in septic shock? A good indicator of that would be a fever. If you don't check temperature, you might not know. And then third, kind of to go along with the medications, if you feel uncomfortable with the dosing or a medication for a specific emergency, and there is an alternative that the dosing better, do that. So like if you don't feel comfortable with administering like magnesium sulfate for an asthma condition like severe asthma attack, okay, well then let's look at is epi warranted? Do we throw a steroid at it? Things like that. Salumedrol. Sorry, I couldn't think of it for a second. It's things like that. Have a plan B. It's a lot to know as a paramedic as far as medications go for what specific event or medical condition. So always have a plan B. Obviously, when you work on the ambulance, you're going to have protocols that differ from station to station. This is a little different with registry. It's kind of like you have this giant standard set of medications and treatments, and that doesn't always run parallel to protocols. So I feel like you have a little bit more leeway as far as picking and choosing what treatment you're going to do for the patient. I feel that there are a couple different things for various medical conditions that you can kind of get away with that are still going to be effective treatment for your patient. And then last is the integrated out of hospital scenario. This one might be a little bit more stressful than the others. Personally, I thought the cardiology ones were difficult, but the integrated out of hospital, you could get anything. And it'll tell you on the NREMT website, you can get a peds patient, adult, or geriatric. So you want to make sure that you're prepared for all ages. Obviously, pediatric dosing is going to be different than adult and geriatric. For the most part, it's going to all be weight-based. They should provide you with a Broslov chart. Most ambulances carry that, so it's not like you have to memorize all these different dosages for pediatric patients. But again, this is a reason to know your equipment, know what you're carrying, know where that's at in your bag. A little side note here, you can pay, I don't know what the price is off the top of my head, but for the familiarizing yourself with the equipment. NREMT offers this the night before your exam, and I would definitely do it. 100%. And I believe it says on the website that it's been demonstrated that testing results as far as passing have substantially increased for students that utilize this time to get familiar with what they're going to have with them. Not only is this a great opportunity to see the different meds, see the different equipment and whatnot, but it's a good time to figure out, what are you going to do when you wake up for testing day. If you're anything like me, I would be worrying about well, shit, am I going to get there on time? Where do I go? What room do I go to? That sort of thing. All that you can figure out, and it's something you don't have to worry about if you go to this equipment familiarization little night event thing. Also with that, you will likely see some of the testing people or attendants. I'm sorry, I don't know a better word to use for them. Anyhow, you'll see some of them, get familiar with them. You'll feel a little bit more comfortable when you show up the next day. So I just wanted to get that out there as a little tip that I think is very beneficial, especially as far as feeling less nervous and anxious about the day of testing in general. All right, anyhow, going forward with the integrated out-of-hospital scenario. This is going to be the most realistic of all the stations, considering that you're going to have an actual patient that you're attending to, and now it's going to be a person that's acting, but it's not like the other stations where you're isolated to one specific event, whether it be a trauma assessment or managing a cardiac patient. With the integrated out of hospital, it's like you're throwing it all together. So all I can tell you is make sure you're doing a thorough assessment. Make sure you know your medical conditions so you can spot things out and ultimately what medications to use. With that, again, know your medications. It's really just how well you know your material, and mixed with how comfortable you feel, ultimately is going to kind of set the path for whether you pass or fail. Another thing I'm going to say is you will have a paramedic partner. The website tells you this as well. If you do not feel comfortable with a specific procedure, delegate that to your partner. Utilize your partner. If you need your partner to draw up a med, or something as simple as set up a breathing treatment, or anything advanced, especially too. Like if you think your patient needs to be intubated and you don't feel comfortable with the steps to intubation, you don't want to miss something simple like checking the cuff or something on the tube. They're gonna dock you points for that stuff. So you can delegate that to your partner, and then you don't have to worry about losing points for something like that. Other than that, I hope this summed things up a little bit. Like I said, the more you know just going into this, the more you know about all these medical conditions or emergencies, the more you know your medications, the better your assessment is. Conduct that thorough assessment. If you can hit down on all these points, and like I said, the rubrics are on the website. Read the stuff on the website. I mean, they give you a ton of information on what to expect. Don't just go in there blindly and then freak out when you're presented with something that you did not expect. That's really all I can say. I hope this video helps. Please drop a like and subscribe if you don't mind. Like I said, this is my second video. I'm gonna keep trying to upload more and hopefully get more comfortable with it and be able to provide you guys information that I found to help me, and hopefully it will help you. So thank you guys for watching.